project with Toronto Community Housing. I want to welcome everybody to our Integrated Service Model Implementation Plan virtual tenant information session being put on tonight by Toronto Community Housing and the Seniors Housing Unit. I want to quickly go over the agenda for this evening. We'll be starting off now with a welcome and land acknowledgement. We'll be doing some overview of using the Webex tool that we're using for the meeting tonight. At 6:35, I will quickly introduce the speakers who you can see on the screen. At 6:40, there'll be a presentation of the integrated service model. Following that, at around 7:10, we'll do questions. And at 7:55, we'll have a wrap up. I want to let everybody know that for tonight's session, we have both people joining online and on the phone, and we will also be recording this session as well. If by chance anyone is having any technical difficulties or issues with regards to joining online, we would ask and suggest if you could try to refresh or try the link to the session in a different web browser, or if that is not working, if you can phone in. Use the dial-in information for the meeting. And as noted, we will have a recording of this event and a follow-up summary as well of the Q&A later on. I'll walk us through how to use the tools to allow you to do the questions and answers as we move through the session. I'd like to start by doing a land acknowledgement. Toronto Community Housing acknowledges that we are on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, which is now home to many diverse First Nations, Inuit, and Métis peoples. Toronto Community Housing also acknowledges that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaties, signed with multiple Mississaugas and Chippewa bands. So welcome to everyone who's joining us both on the phone and virtually online on Webex. The purpose of the meeting this evening is to inform tenants on the progress of moving towards the new integrated service model for seniors. We will discuss plans on how we are implementing the integrated service model, or ISM, and how it will affect and impact tenants. And we will have an opportunity to ask or to receive and answer questions from tenants later on in this session. As we are using technology, and with COVID, we're doing this session virtually. We wanted to just briefly go over a few parameters for how the session will be conducted from a code of conduct perspective and how we expect people to conduct during this session. And it's very straightforward. We would ask people to be brief. So to allow everybody an opportunity to be able to ask and get a question answered, we would ask you to limit yourself to one question or comment at a time. We would ask everybody to be good listeners and to keep an open mind in terms of the content that we are presenting tonight and the other questions and comments that are being received and discussed. And we would ask everybody to behave respectful with us tonight. And we appreciate your cooperation with this. I will now spend a moment to go over Webex and accessibility. So for tenants who require an accessibility-related accommodation to participate in this session, we wanted to note that using adaptive technologies may work best with the telephone or phone-in dial-in option for this evening. Panelists and myself will be describing content on the slides during the presentation, acknowledging that some of the attendees tonight are just connecting in via the phone, so they can't see the slides. So we'll do our best to describe the slides as we go through the content. And we are aware that there are some accessibility limitations within the Webex platform that we're using tonight, and that we are working with the software owner, the provider of this software, to address them. And we appreciate your patience as we work forward on that. I'm going to quickly go over how to use Webex at this point for the question and answer period. I will repeat the instructions for this later on when we actually open up for the questions. So if you have connected in online using Webex, if you want to ask a question, what you will do is you will click it's a little dot button at the bottom of the video window and select Q&A. You can then type in the box to the lower right hand of your screen and click send. This will then send your question in. We will have a city staff member who is moderating the questions, and only staff will be able to see your questions. Later on in this session, when we get to the question and answer period, your questioner will be directed to the relevant panelist and answered during the Q&A period after the presentation on the integrated service model. If you're on the phone and you want to ask a question over the phone only, what you can do is on your phone, you hit *3 to do what is called raise your hand. And this will place your name into a queue based on the order of anybody who hit *3 and raised their hand first. The moderator will select and individually unmute participants with their hand raised by announcing the first few digits of their telephone number. And when you are selected and unmuted, you will hear 2 beeps. This means you can ask your question. Please note that if you hit the *3 button earlier on in this meeting, you will be put into the queue and you will have to wait until later on when you're unmuted for your question to be asked. I'll repeat these instructions when we get to the question and answer period. Protecting your privacy. One of the things I wanted to reiterate is that, as mentioned earlier, this is a public event and it is being recorded. The recording will be posted on the TCHC website as a follow-up to tonight's session. If you are asking a question, whether you are typing it in the Q&A online or over the phone, we ask that you please do not share any personal information such as your full name, your address, when you do that. And if there is, by chance, a private matter related to your tenancy, we would ask that you can also contact TCHC at the TCHC Client Care Center, and I'll give the number here. It's 416-981-5500, or info@torontohousing.ca is the email address. I'd now like to take a moment to introduce our panelists for this evening. With us this evening, first off is Jill Bada. Jill is the General Manager for the Toronto Community Housing Corporation TCHC Seniors Housing Unit, and Jill is waving. Jill will be providing an overview presentation of the integrated service model in a couple of minutes. I'm again Grant Coffey, the Project Director for the Seniors Housing Unit Integrated Service Model project. Also joining us tonight is Andrea Austin, a Manager of Senior Services at the City of Toronto. Thank you, Andrea. And Jen St. Louis, Manager Tenants First, City of Toronto. Thank you, Jen. So Andrea, Jen, and I will support Jill after Jill gives the presentation on the integrated service model upcoming now. And before we get to the Q&A later, again, I will go over the instructions one more time. And with this, I would now turn it over to Jill.
Good evening, everyone, and thank you, Grant. Thank you, everyone, for joining us tonight and taking so much of your personal time to take part in tonight's session. It's extremely important for us to hear your questions and to share information with you, so we are very grateful that you're taking part. So as we get into our discussion tonight, really wanted to have a bit of a chat about the need for our integrated service model. It's important to indicate that as the city undertook a significant review through our Tenants First work at the city to talk about the need for a consistent delivery of housing services for seniors within Toronto community housing, and to acknowledge that there was, in our current model, some opportunities to improve both housing and healthcare services to our tenants. The intent of the Tenants First initiative and the integrated service model is to improve through a series of initiatives both the conditions and services available to our tenants, and to include to offer the creation of new standalone opportunities for service and supports, as well as the new standalone Seniors Housing Corporation. I'll go to the next slide, Grant. And so as we talk about the model, there really are three goals related to the integrated service model. There is the objective of creating a relationship of trust to improve and have better housing services available to our tenants, and to improve access and health and community supports. And I think those three things are critically important to the community in our seniors housing buildings because, you know, many of our tenants are dealing with different circumstances, both culturally, geographically, and personally, that require them to have opportunities to have further supports available to them. Next slide, please. So the four key innovations that we focused on as part of this work is to create a new Toronto community housing staffing model, which I'll talk about in a few moments, to speak about the senior-specific policies and procedures that we're looking at as a result of our work that will improve tenant access to both services within their buildings, as well as procedures that make it easier for them to access support. Seniors Health and Wellness Hubs, which is a new innovation as a result of our new model, and our partnerships with the local health integrated networks, care coordinators, that is part of our new integrated service model. Next slide, please. So our new staffing model. The increased staffing levels across the seniors buildings are a critical part of the work that we're doing. Staffing in seniors housing units often require specific training to be able to address and support different types of conditions that our tenants are dealing with. Many of our tenants, all of our tenants actually live independently, but many require specialized supports and services in order to continue to live independently. And through our initiative to keep our tenants living independently and continuing to have the supports necessary, the initiative really focuses on us having increased staffing levels in our buildings that not only support the physical building, but also the general health and welfare of tenants. Through the newly created seniors services networks in each building, there will be clusters of community service coordinators, which are newly created positions that will actually provide specific supports for access to our tenants related to both their health, wellness, and well-being in each of our buildings. We will also continue to enhance through new positions like our senior services coordinators jobs as a main point of contact for tenant-facing concerns, things like tenancy services, referrals to services. And also those staff will be working directly with the care coordinators through the local integrated health networks to provide necessary supports to our tenants and make sure that they have the necessary information to progress through their tenancies. Next slide, please. We've also been looking at our policies specifically, and in looking at our policies, we're looking at things that are not only our existing practices, but where we can actually improve those, where we can streamline things. So as an example, in each of our, in the integrated service model, we have 5 geographic regions in our city. And so rather than our tenants, seniors tenants, having to travel to one location for support related to their tenancy, we will have regional offices set up in each region to allow tenants to have local geographic supports where they don't have to travel long distances in order to have access. Some seniors tenants, you know, may have individual challenges in maintaining their units and keeping them in certain conditions. And so some of the supports that are being implemented will provide them the necessary connections to both our own staff and the health networks to make sure that they have barrier-free access to community support, as well as community engagement, quite frankly, with members in the community to give them well-being and aging in place. Next slide, please. The Seniors Health and Wellness Hubs are actually a very critical part of our implementation. We will work to have on-site and in select seniors housing buildings, one hub in each of the 5 regions, where we will have health, social, and wellness services offered by external partners and agencies, not only agencies we've currently dealt with and partners, but actually additional new ones. We're also exploring partnerships with the Seniors Active Living Center as part of the ISM Phase 1 in the Southeast region with Wood Green, and tenants will be engaged in that. And those Seniors Active Living Centers actually provide valuable help and access to our tenants to be able to actually access active living within the community, whether it be physical activity programs, mental health programs, etc. Next slide. And then the designated care coordinators, which we've mentioned, to our local care coordinators, will be liaising directly in our buildings between patients and healthcare providers. Partners with our Toronto Central LHIN local integrated health network will be working directly with our staff in each of our 18 buildings in the first phase of Southeast, and will be working directly to be able to support the tenants of those buildings to provide the local support necessary for them in their local community. And designated care coordinators will be assigned to each building so that tenants are aware of which supports are available in each of their sites. Next slide, please. From an engagement perspective in 2020, we are planning on having 4 quarterly Senior Speak newsletters, which we've been continuing to do throughout the year. The Southeast region is actually part of our first communication, which has started this month, obviously, and will continue into early 2021. We are also launching the Seniors Tenant Advisory Committee, which was actually initiated through City Council this year, and we have gone through and done a significant amount of interviews with interested applicants, and are actually holding our first meeting with successful applicants in mid-December. We also conducted a tenant experience survey in the Southeast region in October 2020. We received 1,200 responses, which represents 43% of the residents in the Southeast region, and that survey closed at the end of November. We're currently going through the feedback from that tenant survey, and we'll be sharing further information through our newsletter and to tenants so that we can gather information and relevant subjects that we can talk to our tenant advisory committee with, as well as to tenants overall. Next slide, please. So as I mentioned, our first ISM region, as you can see here on our geographic map, phase 1 was starting on the 11th, which is this Friday, with 18 buildings in the Southeast region. Phase 2 will start with the West and the Downtown in 2021, with 30 buildings inclusive. And then phase 3 will be happening in 2022, with both the Central and the Northeast, with 35 buildings included. Next slide, please. The buildings in the Southeast region, which I won't go through in detail here, but you can see them all here. So beginning in December, the ISM will launch in the following buildings so that we have the new integrated service model implemented throughout the month of December and into January. And we'll be looking to talk to tenants in each of these buildings so that we can gather feedback and critical comments about how things are working going into the new year. Next slide, please. It's important to identify that through the city's direction to not only look at the Seniors Corporation, but also implement the integrated service model as part of Tenants First, that we actually have a need to be able to have a direct accountability to identify the benefits and value of the seniors model within our buildings. So Toronto Community Housing is directly delivering the ISM model to seniors buildings. The City of Toronto will oversee through Senior Services and Long-Term Care, as well as the administration team, to evaluate the accountability framework related to the integrated service model. And so the accountability framework will outline how the City of Toronto will oversee and evaluate with various measures and metrics how we will evaluate the value and the benefit that is being seen by seniors tenants living in our sites. Slide, please. Measuring the integrated service model progress will be critically important. So that will include an annual tenant experience survey that will evaluate tenant perceptions, which is really important to get the honest feedback of our tenants and residents to understand the things they think are working well and the things that we have opportunities to improve. There's over 25 indicators that both Toronto Community Housing, the Toronto Central LHIN, and the City of Toronto will be used to evaluate the model. And these are just some of the examples. So there will be, as an example, the number of maintenance work orders, the number of pest control requests, the number of community safety events, the value and number of arrears, the number of LHIN-funded services offered in buildings, and other indicators in the accountability framework will be shared publicly as we proceed into 2021. So the new Seniors Housing Corporation, and what is it? So for those that aren't familiar, in 2019, City Council approved the creation of the new Seniors Housing Corporation to operate a seniors housing unit. That corporation will be responsible for the city-owned corporation with its own board of directors and CEO. It will be independent from the Toronto Community Housing Organization, We will manage and operate TCHC's 83 seniors buildings. TCHC will continue to own properties, so all of the real estate capital will remain within Toronto Community Housing. But the corporation will be responsible for running the integrated service model and the operational delivery of service to tenants. Tenant leases in 83 buildings will carry over to the new Seniors Housing Corporation, but tenants will not lose their housing as a result of the new Senior Corporation. I need to emphasize that. So anyone who has a current lease with Toronto Community Housing, those leases will be grandfathered over to the corporation as it proceeds, and will be gradually over time based on expiration migrated to the new corporation. Next slide, please. Due to COVID-19, the due diligence required to get the final council approval for the corporation has been delayed, as everyone can probably imagine. In October of this year, City Council recommended that the creation of the new Seniors Housing Corporation be delayed until the city needs related to COVID were clearer. City staff are continuing to work on those efforts and intend to bring a council report back to City Council in the spring of 2021 with a recommendation for the final timeline for creation of the corporation. In the meantime, the integrated service model will continue to be rolled out in accordance with the phased-in implementation plan that we've had, because both the integrated service model and the corporation go hand in hand in improving aging in place with our tenants. Next slide, please. For upcoming activities for 2021, we're going to continue to develop and align our policy and processes with regards to the integrated service model. The Seniors Tenants Advisory Committee will meet every 6 to 8 weeks. We are continuing to plan for the Seniors Health and Wellness Hub implementation as part of phase 1. We continue to engage with staff, our unions, stakeholders, and tenants. Dr. Christine Shepherd, as an example, will be holding virtual focus groups with us for tenants in the Southeast region in January and February, which will further inform the benefits, value, and feedback from our tenants about how the implementation is proceeding. And we'll use those opportunities to actually tweak or adjust what we're doing in phase 1 to improve as we continue to implement further phases. We're going to continue to analyze the data from the tenant experience survey, and we're going to assess the integrated service model performance measures as part of the framework, and continue for the future phases of phase 2 and 3 as we proceed through 2021. We also are planning on having a city staff that will report back to council, as I mentioned, in 2021 with a recommendation on the creation of the corporation. And TCHC will continue to support the city and work with the city on the next steps for the Seniors Housing Corporation.
Thank you, Jill.
I think we're now, Grant, at our Q&A portion.
Thank you, Jill. And so what I'm going to do now is just to go over the instructions for how to bring forward a question as part of the Q&A, and I'll just quickly walk through the instructions again. So if you're online on Webex, you can click the ... button at the bottom of the video window and select Q&A. You can type your question in the box to the lower right hand of your screen and then click send. At that point, your question will be received by the moderator, and only staff will be able to see your questions initially. Your question will be directed to the relevant panelist and answered during this upcoming Q&A session about to start. If you have connected with us over the phone this evening and you want to ask a question, if you can enter *3 on your phone, this will do what's called raise your hand. And at that point, your name will be placed into a queue based on the order of who raised their hand first. And I do see hands starting to be raised on the list. At that point, the moderator will select and individually unmute participants on the phone with their hand raised by announcing the first few digits of their phone number. When you are selected and unmuted, you will hear 2 beeps. This means you can ask the staff your question. And I just want to take a quick moment to just remind people we are recording this session as mentioned earlier. We would ask that if you are submitting a question or asking a question over the phone, to not provide any personal information. Please don't include your full name or your address, but you can obviously ask your question and we will direct it to the appropriate panelist. At this point, what I'm going to do I'm going to leave the questions information up on the screen, and I'm going to turn it over to our moderator for the question segment, one of our team members, Rima Patel. And Rima will start to work through any of the questions received and direct them to our panelists to answer. I would just ask our panelists to make sure that their cameras are on, which I see they are, so thank you. And they will unmute as the questions are directed to them. So I will turn it over to you, Rima, at this stage. Thank you.
Hello. I have a question about the security of the senior, especially senior housing building. It can include all the buildings, but more for the senior housing, senior like buildings, where people need a lot of like security support during the day and especially during the night, where there is no even superintendent available. What I'm thinking is really they need a kind of security full time to like be able to help them for different like urgent cases, that the record will show that how many cases that has happened without any immediate help. The phone line and other like contacting for facilities doesn't help. And especially during this COVID-19 and the economical like problem in the city, there are a lot of cases of robbery, including my building, where the robbery cutting line, like going through like cars, stolen a lot of like items, and people are very like scared now that this can happen anytime during the night when they are coming back or when they want to go out. And this is a very important issue, and I hope that there is some studies, some research, and some plan to help the security of the building. Thank you.
So Grant, maybe I can field that question. So thank you very much for your question. Security is an ongoing priority for us for sure. Integrated service model looks to create aging in place, and certainly part of aging in place is being able to feel safe where you live. So as we go through the implementation, we are going to be doing reviews of each of our sites as it relates to security. We have several provisions in different buildings depending on where they're located in the city and the different circumstances, and so we'll be continuing to do those reviews. Our tenants always have the opportunity to call our client care center if they have any immediate concerns on a day-to-day basis as it relates to security. But I would say that I appreciate your comments, and I understand that there are different buildings that are facing different circumstances. And so as we implement the new model, we will be looking at security in each site and wanting to make sure that there are proper and adequate provisions for security as it relates to tenancy for sure. So thank you very much for your question.
Hello, my name is Kathy Birch. I'm the chair of the RPATH committee. And hello, Jill, Grant, and the team. I think it's really important to let your seniors know about accessibility going forward with the new ISM. That should any of the seniors need their units modified for medical reasons, it will still follow the same process as being in Toronto Community Housing. The application is the same form, and it will still go through the same exact process.
Thank you, Kathy. So nice to hear from you. Yes, absolutely. I thank you for raising that. It's important to highlight to our tenants joining tonight and those that will listen to the information in the days following. But yeah, absolutely. Our existing programs related to accessibility and modifications for units will remain the same as we implement the integrated service model as well as the corporation. We are very focused and committed to creating accessibility for our tenants in our building. And we thank you for all the work that you and RPAP do, Kathy. And we want to continue to make sure that tenants understand that process, and we continue to highlight opportunities for information to be shared. So thank you. Do we have any other questions, Grant? Rima?
Yes, I don't see any other questions at this point.
Okay.
I'm just going to quickly check if there might be others that I don't see any in the Q&A.
Maybe, Grant, it might be helpful for me to share a few things that I might have anticipated as questions this evening. And even though they hadn't been asked, maybe I could share them with people because I know that they've come up through casual conversation with tenants over the last several weeks as we've been working through our plans. So I think one thing that's very important to mention to everyone taking part tonight and to tenants who will see this information in the days following, there is really nothing that this integrated service model will do in terms of taking away programming from an individual building. To be quite honest, what the integrated service model seeks to do is to add additional programming to a building and actually equalize the access to programming in each community so that everyone can actually count on a certain level of service and access to those services that help them continue to keep their tenancy. So it won't really necessarily take anything away, but what our aim is to actually add additional value programming for tenants so that they have access to proper health supports and community involvement and engagement so that they feel part of a community in a greater way than they maybe do today, and to actually give them access to supports that they might need. The other thing that I think may have come up with a couple conversations with some tenants is questions about, will the city be taking over seniors housing and the seniors housing unit? And as you may or may not be aware, as I mentioned, there is a seniors housing corporation being formed, which would be a corporation of the city, but that doesn't mean the city is taking over seniors housing. Toronto Community Housing currently is a solely owned subsidiary of the city as a corporation. And so the new corporation will be no different than what you've experienced with TCHC, other than that the seniors housing will have its own corporation to continue to support tenants and provide necessary models and supports for maintenance as well as health supports for them in their tenancy. Those are a couple of things that come up, Grant, over the last couple of weeks. I thought I might just highlight them for you.
Thank you, Jill. One of the other questions that maybe we could just reiterate for those on the phone is just a bit of the timing of the implementation across the different buildings, since there are 83 buildings that we have to get through. If you could address that possibly quickly.
Yeah, absolutely. And I think I spoke about it a couple of minutes ago in terms of the timelines for what we intend to do from a implementation perspective. So as I mentioned, we are looking to implement the first phase starting at the end of this week and throughout 2021. Towards the latter part of 2021, we'll be implementing both buildings in the west and the downtown, and there's 30 buildings involved in that implementation. So there'll be 30 individual seniors buildings involved in phase 2, which will probably happen, as I say, in the later part of 2021. And then in phase 3 in 2022, we will look to implement the seniors housing implementation for Central and Northeast, which is 35 buildings. So we will post further information, and Grant, I think as we post our information, we can identify each of the buildings in each phase so that it's clearer for everyone to see in writing, so they know exactly when their building might be when the timing might be for their building to be included in the implementation.
Absolutely, yes, we can do that for sure. And one other question that we sometimes hear a bit about is how we will address improvements on maintenance within our buildings and having clean and well-maintained buildings. Maybe you could just expand upon that, because we sometimes get questions about how the ISM will help with that a bit further.
Absolutely. So as part of our integrated service model, not only are we instituting new positions that support social support and health supports, but we are actually increasing our maintenance and building staff in each of our buildings that will help support better custodial maintenance work, et cetera, in the building. We're also working towards being able to increase our hours so that there is 7-day-a-week support in our buildings for tenants, so that they will have someone in the building to go to 7 days a week if there should be a need to have access to someone for something that is urgent. And so there are several different improvements we're doing to not only address both the number of staff there to manage both maintenance and other things, but also the number of days in a week that currently would be available in each building to 7 days per week.
Okay, thank you, Jill. And I believe we've had a question come in on the Q&A. We seem to be having some sound issues with Rima being able to hear her right now, and they're working on that behind the scenes. So what I'll do is I'll just read out the question for everybody, and I think this one, maybe Jill, you could respond to this one as a starting point. So can you articulate what plans are there to integrate technology into seniors' facilities?
Well, that's a really good question. So thank you for whoever asked it. So we are actually looking at continuing to automate our tenants' access to being able to make requests online is one thing I would say from a technology innovation perspective. So from a tenant experience perspective, we're looking to be able to automate your ability to make requests online to our staff as it relates to general tenancy matters. We're also looking at integrating more technology for our staff in buildings so that they have access to things that will help them more real-time see work orders, see requests, and being able to action those in a more real-time environment. And so there are several things that we're working on, particularly as we roll out the integrated service model and get into 2021 and 22, that will look at actually creating technology innovation, not only on the tenant side, but actually on the staff side as well, so that everybody could have an ability to put things in the system or send them electronically and have them arrive on somebody's tablet or smartphone first thing so that they can be actioned in a quicker way. So we're working on those advances, and we'll share more information about those plans through the Seniors Talk newsletter and through our website as well.
Okay, thank you, Jill. And I believe we may have a question on the phone, so I will pass it over, Rima, if you're able to bring that person in to ask their question.
Hi there, Grant. Can you hear me now?
Yes, we can hear you. Thank you.
Okay, great. Okay, so we're going to go to a question on the phone. The phone number starts with 416-258. Again, I'm going to unmute you right now and you can ask your question. Go ahead.
Thank you so much. Hello, everyone. Hi, Jill. Hi, Grant. Hi, team. My question sort of piggybacks off some of what's already been covered. There was a mention around maintenance as well as literacy and being able to leverage technology. First, with regards to maintenance, how within senior living will there be sort of reviewing outside of what was acknowledged with increasing staff, reviewing what is being currently utilized in order to take a look at reducing the amount of touches. Just acknowledging from a past seniors meeting last year in November of 2018, there was a consensus that having maintenance, including, let's say, pest work done, it is quite the burden and stress on some of our seniors. So just looking to ease that. My next part of my question is with regards to literacy and power and partnerships within the city, for example, with Toronto Public Library, to be able to provide some technological and computer literacy for our senior living tenants? Thank you so much.
Those are such great questions, so thank you for the questions. So I think as it relates to your first question, which I think I had a bit of an audio issue, but I think it was related to kind of pest control and kind of the way we're going to automate those processes for tenants and make it easier for them. One of the things that we're implementing as part of our new model is an actual specific team within seniors housing that deals specifically with an ability to support tenants as it relates to things such as pests and other things that are specific to units. And so we'll have staff. There will be a monthly opportunity for staff and buildings to talk about tenant challenges that are going on. And there'll be a specific team that deals with anything that is going on as it relates to pest control, any kind of other issue that is happening, which is not unlike today, but is a little bit more specific. So we're adding additional resources to that effort, and we'll focus some more time on those things. As it relates to literacy, I would say that Toronto Public Library is one of our best partnerships we have. Vickery and her team are phenomenal in terms of supporting us with both mobile libraries, computer literacy programs, and so we're continuing to build that capacity in the model as well. And we'll work with the seniors assisted living centers that I mentioned earlier to have community programming that gives seniors tenants access either through the seniors access living center or through buildings to technology, to devices, to be able to get computer training, basic skills, access to Wi-Fi, those kinds of things. And so I think all those things combined will really help. And so there's several things that are specific around partnerships within the Toronto family and access for tenants either in our buildings or through partnerships that will hopefully improve literacy and give people more access to services.
Thank you, Jill. At this time, I just want to reiterate to everybody on the meeting that if you do want to ask a question, you can hit *3 if you're on the phone, and you'll go into that queue with your hand raised, and we can bring you in. And I know a few people have been asking questions already. And then if you're on the computer online, you can hit the ... button at the bottom of the window and click on Q&A and enter your question. Right now, we don't have any more questions, but I just wanted to ask one maybe that we've heard, Jill, in some of our engagement with tenants, is just with regards to the Seniors Housing Corporation, will the city be taking over the Seniors Housing Unit is a question that we sometimes hear.
Yeah, so maybe, Jen St. Louis is on the phone, my colleague, and maybe I'll let Jen St. Louis jump in. I'm happy to add comments, and maybe Jen could speak to her comments on that as she's leading the work and the due diligence as it relates to the corporation.
Just coughing here. Sorry about that. Okay. Need to drink some water. So as Jill mentioned earlier, the city doesn't have an intention to take over the Seniors Housing Unit and operate it. We are looking to create a new city housing corporation that will operate the seniors housing. So it will have its own board and its own executive, but it won't be directly operated by the city.
Great, thanks, Jen. We're going to go next to another caller from the phone. This caller, their first 6 digits start with 416-797, and I'm going to unmute you now and you can ask your question. Go ahead.
Hello.
Hi there, go ahead, ask your question.
My name is Yoso and I'm living from last 3 years at 12 Thorncliffe Senior Building.
Sir, you don't have
10.
to, we actually don't need your address. If you can just ask your question, that would be great.
Okay, my question is, I'm living on a ground floor and I involved in a raccoon and mice and cats and all kind of in summer and now, and they're supposed to be put some panels over there, and there's some, because it's all open, it's in your building, and it's very nasty and it's dirty, and sometimes looks very weird. I was talking with Kathy Hoover. She said they're supposed to start some work. But I don't know, unfortunately, because of COVID that happened or what happened, I really don't know. So please, my wife have arthritis, and this is a terrible thing. We're at the ground floor, and it's like it's not safe. We can't open the door because she's scared. So can you give us a basic idea, like when they're going to start work to put some panel on or do some work on it, or I don't know.
Thank you for your question, Joseph. So you're correct. There have been some plans for capital improvements at Thorncliffe, and unfortunately, on the basis of COVID, some of that work has been delayed because of access and trying to reduce the amount of people coming into the building to do capital improvements. However, I would say that we are working now closely to try and improve. I'm familiar with the challenges at Thorncliffe, and we are doing our best to try and get that work in motion between now and the end of the year and into the early new year. So I apologize for that. And maybe as a takeaway, if you wanted to get in touch with my office directly, then we could chat one-on-one, you and I, about what the work is that we're planning at that site. And you can access my email address through the TCHC website. And maybe, I don't know if Rima, we can get Joseph's information offline from the Q&A, and then I can get in touch with him directly.
Great, sure. We will try to connect.
Thank you so much. Thank you.
Our next question comes from online. The question is for Jill. What oversight will there be for agencies operating in senior buildings?
So that's actually a really good question. So today we have a model where we are able to work with and evaluate the effectiveness of the partners that we work with in our buildings. As we continue to go through the implementation of the new service model, though, there will be further indicators as a result of our accountability framework that measure the value and the value add that our partners are providing to our tenants. And so the measures that I mentioned earlier in the presentation will specifically identify the partners that work in our buildings to support tenancy and identify key measures around value for our tenants. And if there are issues or challenges, we will be addressing them rather quickly to make sure that we're working with partners that are able to actually do, great supportive work for our tenants. And if they are great partners, then that will continue. But I would say through our new accountability framework, there'll be additional measures, as well as our own work within TCHC around our day-to-day building management that will both create accountability for third-party partners.
Jill, can I just add something to that?
Of course.
So I just wanted to say that we at the City and Senior Services and Long-Term Care have been working very, very closely with Toronto Community Housing Seniors Housing Unit, with Tenants First, to develop this model. And one of the benefits of us working so closely together is that around the Toronto Senior Strategy, we have recommendations across the areas of health, housing, transportation, employment, income, and access to services. And we've been able to continue implementing those recommendations even during the COVID response. And we are currently undertaking a review of the over 40 plus services for seniors that the city offers. But we're also working closely to determine exactly what the services are at the provincial level, at the federal level, and then in the community-based not-for-profit sector, which depends on geography and provider and other factors. So this tighter, closer working relationship means that we can just stay very closely connected in terms of what services exist for seniors and making sure that they're aware of what services exist, health, housing, community, and so on.
Great, thank you, Andrea. Our next question is a concern that some tenants have expressed in the past, which is, will the ISM take away the existing programming in my building?
Thanks, Rima. So I think I tried to address this question a little earlier. So I would say that in today's model, we have different supports in different buildings. And so the thing that the integrated service model seeks to do is to create a level degree of support in every building, so that it's not just a particular building that's lucky enough to have a couple of partners included, whether it be PACE or other, community support partners we have, PACE or Wood Green, whatever it may be. So I would say no, we won't be losing support. Instead, it will be an increase in support that each building will receive. And we'll also have the increased support of the care coordinators through the local integrated health network. So it would be, our aim through this is to actually have an increased value of supports available to every building, so that every tenant has equal access to those supports and the ability to take part in them.
Great, thanks, Jill. That's it so far for questions. So Grant, I'm going to turn it over to you.
All right, thank you. So on behalf of everybody this evening, we wanted to say thank you to everybody for attending. We really appreciate you taking the time out of your schedule and evening to be part of this event with us this evening to talk about the integrated service model. We are very excited about the future with regard to this model and what it brings and will bring for our tenants and outcomes we're trying to achieve and improve and help people with aging in place. Please be sure to check torontohousing.ca/seniorshousing for the recording and summary of this presentation and the question and answer session. This will be posted as a follow-up to tonight's event. If you have any further questions or comments about the event, you can also contact one of our ISM project team members who is on the event tonight. Her name is Catherine Cavasali. She's one of our ISM project support team members within Seniors Housing. Her email address is on the screen, and I will quickly read it. Catherine, CATHERINE .Cavasali, KABASELE @torontohousing.ca. Once again, thank you to everybody. Thank you to our panelists for answering the questions. Thank you, Jill, for going over the content this evening. We look forward to future opportunities to engage with tenants, and we want to wish everybody a good night, and thank you again.
Thank you, everybody.